Hello everybody, I'm Guillermo Larios. I'm an specialist doctor in a hair disease. Today I will talk about one of the principal causes of death in Colombia and the silent test of all them, the hypertension.
Hypertension is a common condition in which the force of the blood on the walls of your arteries is often too high. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. You can have hypertension for years without any symptoms. Even without any symptoms, damage to blood vessels and your heart continues and can be detected. Uncontrolled high blood pressure increases your risk of serious heart problems, including heart attack.
A few people with high blood pressure may have headache, shortness of breath, or nosebleeds, but these signs or symptoms aren't specific and usually don't occur until high blood pressure uh, has reached a severe or life-threatening stage. I recommend a blood pressure reading at least every 2 years, starting at age 18. If you are age 40 or older, I suggest a blood pressure reading every year.
There are two types of high blood pressure. Primary hypertension. This type of high blood pressure tends to develop gradually over many years. Secondary hypertension. This type of high blood pressure tends to appear suddenly and cause higher blood pressure than does primary hypertension.
High blood pressure has many risk factors including age. The risk of high blood pressures increases as you age. Race. High blood pressure is particularly common among people of African heritage. Family history. High blood pressure tends to run in families. Stress. High levels of stress can lead to a temporary increase in blood pressure.
To measure normally I need to use an inflatable arm cuff around your arm and measure your blood pressure using a pressure measuring gauge. A blood pressure reading given in millimeters of mercury. Have two numbers. The first measures the pressure in your arteries when your heart beats, systolic pressure. The second measures the pressure in your arteries between beats, diastolic pressure. Blood pressure measurements fall into four general categories, being the principal categories normal blood pressure and stage 2 hypertension. Normal blood pressure is if the first measure is 120 and the second measure is 80 millimeters of mercury. Stage 2 hypertension is a systolic pressure of 140 millimeters of mercury or higher, or a diastolic pressure of 90 millimeters of mercury or higher.
Changing your lifestyle can go a long way toward controlling high blood pressure. I recommend you make lifestyle changes including
Eating a healthy diet with less salt, getting regular physical activity, maintaining a healthy weight or losing weight if you are overweight, limiting the amount of alcohol you drink.
Race. Race. High blood pressure is particularly common among